Good afternoon, everybody, and it is such a pleasure to be here with you. It is such an interesting topic. Just to bring you my own experience in this, although being a surgeon myself and having worked with MSF for many years, I wasn't aware about Noma disease until last year. I visited our projects in Nigeria, and that's how I get familiar with something so interesting to deal with. I think it is important to highlight a few points here. I think the fact that Noma affects the most vulnerable, it's a very important thing to take away as a message. Mainly young children, of course, under 5 years old of their age, but there are plenty of adults having survived who need care. There are people living in extreme poverty and dealing with malnutrition and lack of hygiene. This is something that we should always be taking into consideration. And there are members of isolated communities with limited access to healthcare and vaccination. The lack of data shows also how neglected are the most at risk. Noma is mostly, of course, reported in Africa and Asia, but there is no mapping of its global prevalence. And what seems to be more worrying these days is that there is an increase of new, fresh cases that comes to our attention. We need to understand that Noma is preventable and treatable, but people still die from it because of limited knowledge about the disease, and also because of not being able to detect it and this lack of awareness at all levels from health workers, the community, and of course the stakeholders makes things even more complicated and more challenging. Quite indicatively to mention that MSF started supporting the Sokoto Hospital for Noma in 2014. We provided medical care for patients coming from all Nigeria, thanks to different activities, of course. We try to approach it in a holistic way. It is not just about treating the disease itself, which we wish we could be able to treat everyone in the very first stages of the disease. This comes also with nutritional support, with mental health support, and last but not least, the reconstructive surgery that it takes a lot of time and repeated interventions. Noma is a neglected disease, but it's still not included in the WHO, the neglected tropical diseases, even if it fits all the criteria. So MSF today is calling for the WHO to recognize Noma as a neglected tropical disease, so more attention and more resources would be allocated to tackle it. While all this is important, and the fact that so many different stakeholders from NGOs, from the clinical, the academic society, from the human rights society are really interested in how they can do more about this, and the fact that this conference will boost and take it into another level. Let us not forget also the patients and their communities. I think it is the right time to give them a voice, give a voice to the Noma survivors. It is important to work with patients and their communities, as we also do nowadays, working with traditional healers in order to better understand their perceptions, their knowledge of the disease. And by doing so, I think it will be closer to go and find solutions that they can come sometimes we cannot imagine from where, but solutions that we can only bring by raising this awareness and by working together. I want to thank you all for this, and I wish a very fruitful conference. Thank you.